41. What is the priority nursing action for a patient with a new onset of respiratory distress and asthma? Answer: administer prescribed albuterol and oxygen. Rationale: respiratory distress indicates bronchoconstriction. Albuterol and oxygen improve airflow, per GINA asthma guidelines. 42. What should the nurse monitor in a patient receiving for vancomycin? Answer: monitor for nephrotoxicity and ototoxicity. Rationale: vancomycin can cause renal and hearing damage. Monitoring prevents complications, per IDSA antibiotic guidelines. 43. What is the nurse's first action for a patient with a new onset of confusion post-surgery? Answer: assess neurological status and check oxygen saturation. Rationale: confusion may indicate hypoxia or delirium. Assessment guides oxygen therapy, per the Joint Commission post-operative standards. 44. What should the nurse assess in a patient with suspected cholecystitis? Answer: assess for right upper quadrant pain and nausea. Rationale: cholecystitis causes gallbladder inflammation, leading to pain and nausea. Assessment guides surgical planning, per American College of Surgeons guidelines. 45. What is the priority nursing action for a patient with a sodium level of 150 milliequivalent/L? Answer: administer prescribed hypotonic fluids and notify the provider. Rationale: hypernatremia greater than 145 milliequivalent/L risks neurological damage. Hypotonic fluids correct sodium, and notification ensures monitoring, per clinical electrolyte standards. 46. What should the nurse include in teaching for a patient with a new pacemaker? Answer: avoid strong electromagnetic fields and report palpitations. Rationale: electromagnetic interference disrupts pacemakers and palpitations indicate malfunction, per AHA device guidelines. 47. What is the nurse's first action for a patient with a new onset of chest pain post-angioplasty? Answer: administer prescribed nitroglycerin and notify the provider. Rationale: chest pain may indicate restenosis. Nitroglycerin relieves ischemia and notification ensures evaluation, per AHA guidelines. 48. What should the nurse monitor in a patient receiving levothyroxine for hypothyroidism? Answer: monitor for tachycardia and weight changes. Rationale: levothyroxine overdose causes hyperthyroidism symptoms like tachycardia. Monitoring ensures safety, per Endocrine Society guidelines. 49. What is the priority nursing action for a patient with a new onset of fever in diverticulitis? Answer: obtain blood cultures and administer prescribed antibiotics. Rationale: fever indicates infection. Cultures and antibiotics prevent complications, per American College of Gastroenterology guidelines. 50. What should the nurse teach a patient about preventing DVT post-surgery? Answer: perform leg exercises and use compression stockings. Rationale: immobility increases DVT risk. Exercises and stockings promote venous return, per the Joint Commission guidelines. 51. What is the nurse's first action for a patient with a new onset of seizures and traumatic brain injury? Answer: administer prescribed anticonvulsants and ensure safety. Rationale: seizures risk further brain injury. Anticonvulsants and safety measures prevent harm, per AANS guidelines. 52. What should the nurse assess in a patient with suspected pneumonia? Answer: assess for fever and productive cough. Rationale: pneumonia causes infection, leading to fever and cough. Assessment guides antibiotic therapy, per ATS guidelines. 53. What is the priority nursing action for a patient with a potassium level of 3.0 milliequivalent/L? Answer: administer prescribed potassium supplements and monitor ECG. Rationale: hypokalemia, less than 3.5 milliequivalent/L, risks arrhythmias. Supplements and ECG monitoring prevent complications, per AHA electrolyte guidelines. 54. What should the nurse include in teaching for a patient with a new ileostomy? Answer: monitor for dehydration and empty the pouch when half full. Rationale: ileostomies increase fluid loss, and timely emptying prevents leakage, per Wound, Ostomy, and Continence Nurses Society guidelines. 55. What is the nurse's first action for a patient with a new onset of chest pain and aortic dissection? Answer: administer prescribed antihypertensives and notify the provider. Rationale: chest pain indicates dissection, requiring blood pressure control to prevent rupture, per AHA guidelines. 56. What should the nurse monitor in a patient receiving morphine for postoperative pain? Answer: monitor for respiratory depression and sedation. Rationale: morphine depresses the respiratory center, risking hypoventilation. Monitoring ensures safety, per ANA pain management guidelines. 57. What is the priority nursing action for a patient with a new onset of dyspnea in pulmonary embolism? Answer: administer oxygen and notify the provider. Rationale: dyspnea indicates hypoxia. Oxygen and notification ensure anticoagulation therapy, per AHA guidelines. 58. What should the nurse assess in a patient with suspected ulcerative colitis flare? Answer: assess for bloody diarrhea and abdominal pain. Rationale: ulcerative colitis flares cause mucosal inflammation, leading to diarrhea and pain. Assessment guides therapy, per Crohn's and Colitis Foundation guidelines. 59. What is the nurse's first action for a patient with a new onset of fever in a central line infection? Answer: obtain blood cultures and notify the provider. Rationale: fever indicates infection. Cultures and notification ensure antibiotics, per CDC infection control guidelines. 60. What should the nurse teach a patient about managing diabetes post-discharge? Answer: check blood glucose regularly and follow a balanced diet. Rationale: regular monitoring and diet control prevent complications, per ADA diabetes guidelines. 61. What is the priority nursing action for a patient with a new onset of confusion and hyponatremia? Answer: notify the provider and prepare for hypertonic saline. Rationale: confusion indicates severe hyponatremia, less than 135 milliequivalent/L. Hypertonic saline corrects sodium, per clinical electrolyte standards. 62. What should the nurse monitor in a patient receiving enalapril for hypertension? Answer: monitor for hypotension and hyperkalemia. Rationale: enalapril, an ACE inhibitor, lowers blood pressure and retains potassium. Monitoring prevents complications, per AHA hypertension guidelines. 63. What is the nurse's first action for a patient with a new onset of pain in a fracture site? Answer: assess the limb and notify the provider. Rationale: pain may indicate compartment syndrome or infection. Assessment and notification ensure timely intervention, per orthopedic nursing standards. 64. What should the nurse assess in a patient with suspected heart failure exacerbation? Answer: assess for edema and jugular vein distension. Rationale: heart failure causes fluid overload, leading to edema and JVD. Assessment guides diuretic therapy, per AHA guidelines. 65. What is the priority nursing action for a patient with a magnesium level of 2.8 milliequivalent/L? Answer: notify the provider and withhold magnesium supplements. Rationale: hypermagnesemia, greater than 2.2 milliequivalent/L, risks respiratory depression. Withholding supplements and notification prevent worsening, per clinical electrolyte standards. 66. What should the nurse include in teaching for a patient with a new chest tube? Answer: keep the drainage system below chest level and report increased drainage. Rationale: gravity promotes drainage, and increased drainage indicates complications, per American Thoracic Society guidelines. 67. What is the nurse's first action for a patient with a new onset of chest pain and pericarditis? Answer: administer prescribed NSAIDs and notify the provider. Rationale: chest pain and pericarditis is inflammatory. NSAIDs reduce inflammation and notification ensures evaluation, per AHA guidelines. 68. What should the nurse monitor in a patient receiving metformin for diabetes? Answer: monitor for lactic acidosis and renal function. Rationale: metformin risks lactic acidosis, especially with renal impairment. Monitoring ensures safety, per ADA guidelines. 69. What is the priority nursing action for a patient with a new onset of fever and pneumonia? Answer: Obtain sputum cultures and administer prescribed antibiotics. Rationale: fever indicates infection. Cultures and antibiotics target the pathogen, per ATS guidelines. 70. What should the nurse teach a patient about preventing infections with a urinary catheter? Answer: maintain a closed drainage system and practice hand hygiene. Rationale: a closed system and hygiene reduce infection risk, per CDC catheter care guidelines. 71. What is the nurse's first action for a patient with a new onset of shortness of breath post-laparotomy? Answer: assess respiratory status and notify the provider. Rationale: shortness of breath may indicate atelectasis or embolism. Assessment and notification ensure timely intervention, per surgical care standards. 72. What should the nurse assess in a patient with suspected cirrhosis? Answer: assess for ascites and jaundice. Rationale: cirrhosis causes portal hypertension and liver dysfunction, leading to ascites and jaundice. Assessment guides management, per AASLD guidelines. 73. What is the priority nursing action for a patient with a calcium level of 7.0 milligrams per deciliter? Answer: administer prescribed calcium supplements and monitor for tetany. Rationale: hypocalcemia, less than 8.5 milligrams per deciliter, risks neuromuscular irritability. Supplements and monitoring prevent complications, per clinical electrolyte standards. 74. What should the nurse include in teaching for a patient with a new spinal cord injury? Answer: perform range of motion exercises and monitor for autonomic dysreflexia. Rationale: exercises prevent contractures and monitoring detects hypertensive crises, per spinal cord injury guidelines. 75. What is the nurse's first action for a patient with a new onset of chest pain and angina? Answer: administer prescribed nitroglycerin and assess pain response. Rationale: nitroglycerin relieves ischemic pain and assessment guides further doses, per AHA guidelines. 76. What should the nurse monitor in a patient receiving atenolol for hypertension? Answer: monitor for bradycardia and hypotension. Rationale: atenolol, a beta blocker, slows heart rate and lowers blood pressure. Monitoring prevents complications, per AHA hypertension guidelines. 77. What is the priority nursing action for a patient with a new onset of fever in cholecystitis? Answer: obtain blood cultures and administer prescribed antibiotics. Rationale: fever indicates infection. Cultures and antibiotics prevent complications, per American College of Surgeons guidelines. 78. What should the nurse assess in a patient with suspected meningitis? Answer: assess for neck stiffness and photophobia. Rationale: meningitis causes meningeal irritation, leading to stiffness and light sensitivity. Assessment guides antibiotic therapy, per IDSA guidelines. 79. What is the nurse's first action for a patient with a new onset of pain in a casted limb? Answer: assess for compartment syndrome and notify the provider. Rationale: pain may indicate compartment syndrome, risking tissue damage. Assessment and notification ensure timely intervention, per orthopedic nursing standards. 80. What should the nurse teach a patient about managing COPD? Answer: use pursed lip breathing and adhere to prescribed inhalers. Rationale: pursed lip breathing improves oxygenation and inhalers reduce bronchospasm, per GOLD guidelines.